Hello, Barry G. Houston's dancing psychiatrist here. Wanted to do an update on something I spoke with you all about earlier. I spoke with you all about generic versus brand name medicines, and just to recap, I spoke about the fact that while the active ingredient are the same, the fillers are different, and the fillers can affect the absorption and sometimes with some patients the actual tolerability of the product. So they can affect the absorption and thus the efficacy, meaning how well does the drug work. It can also affect the tolerability, i.e., side effects. So these are things to think about. Now, the good news is for a good number of drugs, the generics are relatively well tolerated and they are generally effective for the treatment diseases that they're attacking. That's a good thing because the cost is much different if we're having to pay out of pocket. Most medications that are brand name are not affordable for most people if they're having to pay out of pocket. In other words, if the insurance company will not cover it. That being said, I did want to remind y'all that there are certain medications I know with thyroid medicines and some of the medicines that I prescribe as a psychiatrist where the drugs are just not as effective. Meaning that while the PK studies, the studies that were submitted to the FDA indicated that the absorption was good and adequate, patients will tell you, I was doing well on this medication, on the brand name, and I am not doing well, both from a side effect standpoint or an efficacy standpoint on the generic. And that I see every day, not with every patient, not with every drug, but there's certain drugs that comes prominent with. Also, as more and more generic drugs are out there, there's more and more generic makers, and I've had patients who can do fine on one generic versus not another. In fact, I see that quite commonly, where they do not do well, don't tolerate, or don't find one generic efficacious, i.e., it doesn't work, while another generic or the other generics, it does work. So that's important to know that that can exist. I ask patients to be aware of what manufacturers they find are effective and the one or two manufacturers that are not, so that way they can call around and find a pharmacy that hopefully has the generic that they are able to tolerate and that does work for them. That being said, I wanted to make you all aware of something, and it's called Texas State Bill 680. Texas State Bill 680. Now, you want to look for what the equivalent is in your state and in your country where you live. But for Texas State Bill 680, it was actually designed for two parts, but the older part was actually dated back to 2017, which was working on step therapy. The whole concept was to avoid patients having to fail first medications. Fail first means you can't have the brand name drug that you were on that was effective until you fail a generic, or sometimes it's step therapy where it's you have to fail one or two or three generics. The whole concept was to prevent patients from having to be on a cheaper medicine or multiple cheaper medicines first before they can use the medicine that was actually prescribed or that has been effective for them. So there is a way around that, and the way around that is there is a way for the doctor's office to when they do the prior authorization for the medication, attach a copy of State Bill 680, or actually there's a specific form that we can fill out that is a Texas state prior authorization request form for prescription drug benefits. We generally attach the State Bill 680 to the prior authorization request, but there is a specific form that can also be done in lieu of that. And what that allows is that basically requires the insurer, they have 72 hours to respond to our request to keep the patient on the brand name. Now, this is not saying that every patient who's been on a brand name can just stay on the brand name without any consequence, i.e., generally, this still is going to require our patients to have tried the generic, and then if they don't tolerate the generic, then we have grounds to potentially get the brand name approved for them. So these are, you have to have criteria. The criteria that we have to say is, number one, is the drug contraindicated for the patient? In other words, is the generic contraindicated for the patient? Since the active ingredient is the same, you really can't say that with, I think, without the patient having tried the generic first. Is the patient likely to suffer physical or mental harm as a result of changing to that medicine? Once again, that's going to be something that's hard to document and really prove without the patient trying a generic. Has the patient already been prescribed that? Now, sometimes the patient may have received that generic under a different insurer, a different insurance, and the new insurance wants the patient to try that drug again. That should not be having to be required. Once they've tried and failed could either mean not responded or not tolerated, that should be enough to get the drug approved. Will the drug cause, will changing from the brand name to generic cause the patient to lose functional ability in their activities of daily living? And someone like me who treats a lot of ADD people, depressed patients, that could be. So basically, what I want y'all to do is I want y'all to be aware, and I also want y'all to be aware that patients, y'all have rights, and we as physicians, we frequently act like we don't because we've been so beaten down by the system, as y'all have. But there are abilities to try to get the brand name approved. It still is not successful. There are still insurers that, despite that, will deny the product. But I want to make you all aware that in Texas, such a thing does exist, and we're proactive in trying to get that attached to the prior authorization form, and work with your clinician on trying to get that too. Because if the brand name drug clearly is effective and tolerated, and the generic is not effective or not tolerated, then those are reasons to consider. Remember again that sometimes with the generic, we may have to just go higher up on the dosage, because if the patient's absorbing less of the generic medicine versus the brand name, they may need a higher dosage to obtain efficacy. That being in mind, I hope that was helpful and kind of an adjunctive addition to my previous talk that I talked about generics versus brand names. Even though theoretically the active ingredient is the same, the fillers can affect the absorption, and thus the efficacy. And I know that insurance companies don't want to believe that, but we as patients know that, and we as clinicians do that. Not trying to drive a wedge between you, I, or the insurance companies. We need insurance companies. I think most insurance companies, for the most part, really do have an ethical mode of operating most of the time. I'm the kind of person who tries to give people the benefit of the doubt, but certainly we could all have our opinion on that. That being said, this is your dancing psychiatrist, Dr. Barry G, wishing you all a great day.